Hello, everyone. Today, we've got a great topic that I get a lot of questions about. We're going to talk about chronic infections in the mouth and how do they affect your health, and how do we deal with difficult dental issues. Now, today, we're scheduled to talk with Dr. Kelly Blodgett from the Blodgett Dental Care Center in Portland, Oregon. Kelly's just having some connection issues, so I'm just waiting for him to connect. So I thought I'd start off by just asking the audience some of the issues they're having with. We've got a list of questions here in the comments that we're going to go through with Dr. Kelly. But in the meantime, if you let us know where you're listening from and some of the problems that you're dealing with, because what we're going to talk about here is the oral systemic connection and how your mouth and chronic infections in the mouth can increase your risk of issues elsewhere in the body, and how sickness in the mouth can be a sign of and here we are. Dr. Blodgett joins us.
Oh, hey. I was just having to read there. Sorry about that. Trying to get the
You're an avid reader.
That's one of my favorite books. My wife wanted me to say how much she loves your book, by the way.
You tell her thank you very much from me. Kelly, it's a pleasure to finally connect. We've kind of talked virtually for quite a while now. You practice a very kind of individual and very specific and I think important style of dentistry now that is really leading into this, leading us into a new era of medicine. Tell us a little bit about yourself, like where you practice in Portland, is it, and how you kind of started to think about dentistry this way.
Sure. Born and raised in Portland, Oregon. I did all my schooling here. Crazy enough, dental school, residency, all that. I think part of what led me in this direction was that as a resident at the Veterans Hospital here in Portland, I had the benefit of working with specialists in a lot of different, specialists in different areas of medicine. And it just helped me open my eyes to how everything was connected. And over time, I've just, continued to pursue more education along those lines. And, it seems like it turns out there's a lot of people that are looking for this kind of care. So it's been a really great time in the practice.
Yeah, the mouth kind of leads you on these journeys, right? Like it's amazing, when you kind of think of, how, maybe you looked at dentistry differently, when you first trained, and then, what all these other people are doing in the world, and then, how it really all connects. It's fascinating. Kelly, people, they probably come from a long way to seek out, a practitioner like you. How would you start by describing some of the symptoms that people are kind of feeling in their mouth, and the feelings and the connections to some of the health issues that they're also suffering? Because this is the hard problem that a lot of people are kind of dealing with at the point, is they have these very nondescript symptoms and they're wondering if it's connected to an underlying issue in the mouth.
Yeah. It seems like a lot of the folks who end up finding us at Blodgett Dental Care they might have systemic issues, something else, like maybe, like I was just talking with a guy today about his Hashimoto's thyroid issue. And it turns out, the only root canal he has in his mouth is on the upper first molar, which happens to be, the one tooth that's connected to the thyroid. And it seems like folks go down this track of doing a lot of health assessment and trying to find the underlying cause within their body. Why are they not healthy? And they change their diet. They improve their sleep. They do a lot of things, but in that process, rarely are people asking questions about tell me about your oral health. And frankly, that wasn't the way I was trained either. Not part of the medical model. So yeah, a lot of folks come to us after they've done a lot of research. Much of it, like reading books. It's interesting enough. I was just thinking as we were getting online, like I came to hear about your book from patients, people who were doing their own research. That's how I heard about Weston Price, was through patients who had done research. So yeah, that's a lot of folks are looking for solutions to their other health problems, and they may have zero symptoms at all in their mouth. They might have 5 root canals, no symptoms at all in their mouth, but they have a multitude of other health problems throughout their body. So that's a lot of the folks who come find us now.
Yeah, finding the same, the same pattern. There's a big kind of awakening of people there that are trying to connect the dots themselves, and they're looking for practitioners that have gone on a similar journey themselves, and really the oral medicine side of it is a difficult one for them to kind of tackle, and it really kind of comes into this cross of what dentistry is designed to kind of treat and fix dental disease and address quite chronic problems in the mouth. So one of the you mentioned root canals. So why don't we start there, because we get a lot of questions about root canals, right? So
yeah.
Let's go back to the start. Someone's got deep caries in their tooth down to the pulp. Let's explain to them what thought process would you be suggesting they start to think about if they're going to go through treatment at Blodgett Dental Care, and what are some of the connections to the body, and how are we going to start to think about this more holistically?
Right. Oh, it's such a great question. The first thing that we generally acknowledge, if somebody has a tooth where whether the nerve's angry or not, but as you're mentioning, like the caries has gone to the pulp, traditionally we were trained to say you need a root canal. And again, it's an option, certainly. We talk about what might they expect from that kind of treatment long term. How might it affect their health holistically? And how can we actually seal up an entity that's porous, right? Once that nerve complex is removed and all those dental tubules become dormant and passive, it just allows all these multitude of highways for bacteria to get into the teeth. So some folks who come to us decide, for the time being, root canal is going to work best for me. The vast majority of the folks we see they've already had the root canal. Like I was thinking of the one I just took out a couple hours ago. The gal had the first root canal done 18 years ago. It abscessed. 9 years later, she has it retreated. It abscesses again, and here we are almost a decade after that. And now we're finally taking it out and removing all of the infection that's around it. And of course, she has health symptoms associated along that meridian. And that's the other thing that we spend some time talking about is we pull out tooth energy meridian charts so that patients can see. I mean, and heck, we just give it to them. They can take it home. And they can look for themselves at which teeth do I have, maybe a root canal or a metal filling connected to a metal crown or things of that nature, right? And they can start doing the research themselves if they so choose. But yeah, it's a conversation. It's, we don't in our practice take the approach of you need this, you need that. We actually don't use the phrase you need because, people don't need teeth, right? We have patients who don't have teeth and, they're living, healthy, happy lives. So we try to make that an option and a choice that people could choose to remove the tooth. They could choose to do the root canal. It really depends on their goals for their health overall. And that's how we try to lead them.
Yeah, I think that's a great perspective because, depending on, the person's, where they are in life, losing the tooth really sometimes isn't ideal. And, root canal treatment, is, it's an unideal solution to an unideal situation. Right. That's kind of how if we do it with the perspective that we're giving, maybe this, physically, keeping the tooth, maybe that's sometimes, it is definitely, I still do some root canals. I feel it helps people, to a certain extent. And some people just aren't ready to lose a tooth, right? They just don't want to do it. Yep. And so in those situations, things can really kind of go down a road where their life's not going to improve. And look, when we start talking about these chronic infections, though, these are the things that the literature has for a long time connected to things like heart attacks, cardiovascular issues. Well, now that we're starting to increase our perspective on the vast ecology of the mouth and the bacteria that are living within, and you mentioned that root canals really that we leave a potential opening for
Right.
the buildup of potentially bad guys down in these canals, then this literature has been around for a long time. Where do you see the gap here as to why, because I look at your work and I'm seeing that, you're kind of painting out you're building this bridge between, we're saying there's this connection between chronic dental infections. Can you help people explain what this bridge of science is and where you're kind of, where a chronic dental infection is, mechanistically, creating chronic inflammation, increasing the risk of heart disease?
Yeah, well, and I would say probably just to help people recognize the most common things that they would experience, like we already talked about the root canal connection. Some people may have heard of the term cavitation, referring to an area of bone that just simply didn't heal well after an extraction. Most commonly in wisdom teeth areas, but it can happen anywhere. And then, of course, periodontal disease, right? Gum disease. All of these different routes through which bacteria get into our bodies. You're so right. I mean, there's science going back decades that very clearly connect that. Yep, sure enough, even when you chew, the bacteria around your teeth get introduced into your bloodstream. And the more pathologic that environment is in your mouth, the more pathologic the bacteria is that's getting into your system. So there's a lot of different routes. And of course, if we're not, what I think is the biggest miss in healthcare, or at least one of them, is that it's just not on anybody's radar coming out of traditional, MD medical school, even naturopathic medical school to some extent, osteopathic. It's just really not covered. And part of what my team and I have done is a lot of outreach to naturopaths and stuff in our the neck of the woods here. And one of the best services we've been able to offer is, what kind of questions can you ask so that we're not skipping something that is so obviously an open pathway for pathogens to get into our body?
Yeah, had exactly the same experiences. There's this huge gap in people that are so-called holistically thinking, but there's just absolutely there's a huge blind spot in the mouth, and we've got this conventional connection in the literature between serious disease and oral infections. But then how we deal with that practically really it's difficult for people to deal with. So, right. So look, let's start to think, practically, right? Because, there's a lot of people out there suffering these issues. So there's different levels of infection. So if you have a decay down to the nerve of a tooth, what would you suggest? I mean, obviously there's different choices and there's different routes of pathway, but we've got an abscess. In these situations, would you be suggesting to people, what are the options there, and how would you kind of tackle this in your clinic?
Yeah, in our clinic, we talk a lot about the fact that if you're in this specific situation, right, you have an abscess, there's infection within the bone, and the root that is sitting in that stew of infection is in fact porous. Even the best root canal in the world doesn't clean the exterior aspect of the roots. So how would we expect for that root canal to create health, right? And I clarify, I kind of emphasize that word, because we certainly have seen many times, I'm sure you have as well, where you can create a state of a patient being asymptomatic in their mouth, but in fact, is their body asymptomatic? Like, what's the energetic consequence of leaving a dead tooth behind? So and these literally are conversations with our patients. Like, we just try to present information. It seems to me like people have a sense, either they resonate around the idea of, I'm really stuck on keeping the tooth. We say, great, we're happy to refer you to a great endodontist. Or they're like, I just don't want to take the risk in my health. I'd much rather remove it if it's dead. Great. We can help you do that. Yeah, that's pretty much how we approach it. And then there's the whole process of like, well, if you're going to remove that, how do you help somebody? Because I get this question a lot on Instagram and Facebook. Okay, well, if you got a dead tooth and it's infected and you remove it, but we're concerned about cavitations, how do you make sure that they don't, remain infected? And so we practice a certain protocol whereby people tend to heal extremely well, utilizing different technologies. But it's an open conversation. As you know, I mean, gosh, there's no simple solution outside of the beautiful things you wrote in your book, which is, when I think of decay and abscesses, I'm thinking, gosh, we already missed the boat, where's the diet and the mindset around nutrition such that our teeth don't, the environment isn't possible for that to happen.
Yeah, it's a great perspective. And look, it's a little bit tragic in the sense, like your heart kind of drops when you see, when you show someone, an image of their tooth like this, right? And they are, you are a little bit stuck between a rock and a hard place, when these kind of situations have come. And, I try to bring people back from that point. You try and, you have to be a little bit resolute. Something about dentistry, right, is that, we're about fixing things, right? We want to fix things. But in doing that, there has to be some kind of, final, you have to let things go. And certain, some people have to accept they might lose a tooth. And, there's obviously, modern way to do this, but you have to kind of come to that mindset first, right?
Right. Well, and it's a big deal. I mean, I think about what I've read about, dental care historically, right? Looking back a couple hundred years. And certainly there was a time where, losing teeth was really part of life. Even I can recall being in dental school and in residency, talking with people where their mindset was, well, at what point should I expect for my teeth to come out? Because, my parents, my grandparents, they've all got dentures, right? And that was the norm. And certainly, like, through our era of going to dental school, like, the mindset certainly was more around like, well, almost at all costs, we want to keep teeth. And I think that, in reality, health looks like a balance. Sometimes it's a really appropriate thing to do to keep a tooth, even though there might be some health consequences associated with it. The health consequences of getting rid of it are worse. So it's such a gray area, and it has to be such an individualized process, and so, like, in our practice, new patients, no matter where they come from, our first intake is a 2-hour process. And it is really about getting to know a person and their health history and their goals and their feelings around this process and their nutritional history. It's such, it's like, we just can't look at things and go, well, we see holes, time to drill and fill. Even though I was trained to do that, I certainly experienced that it doesn't get us anywhere that's healthy.
Yeah, I love that. And we're definitely going to dive back into that. I've just got a question from here that does pop into our train of thought at the moment. Stephen Gordon asked, what about a resorption of a root? The only options I'm given as a root canal or having my tooth pulled, and the tooth doesn't, so it's asymptomatic. So what would you suggest to Stefan here? That's a great question. And I would include in that, if I might, along with resorption, that's asymptomatic, any type of chronic oral health issue that's asymptomatic. In fact, like, if your cells, in this specific case, right, resorption of a root, whether it's internal or external, once the cells have decided to have a party and to go, with a destruction crew and tear apart those that roots of the teeth,
we really don't have an option, right? If it's internal, maybe you could do some root canal therapy to hold on to the tooth longer. But again, as we talked about, that's going to have health consequences with it that generally are negative. Externally, it's going to get infected, and chronic infection in our mouth is just a gateway, to problems elsewhere. I have seen situations where people were not willing to take action, and by all means, that's their choice. And of course, there's consequences to that. The lymph system has to drain all that garbage that remains in the gum tissue, which is like asking for lymphoma. I mean, if we continuously expose any area of a tissue to harmful exposure, ultimately it'll say, enough's enough. Kind of like think about lung cancer, right? It's not the first cigarette that creates a cancer. It's that chronic low-grade exposure that ultimately the cells say enough is enough, right? So for Stefan, I mean, it's a bummer deal, but I would really encourage him to look at what would my options be if I removed the tooth? What health benefits would I, possibly gain by removing that? And at the very least, develop a plan. Like if you're just stuck, right? You're like, I'm not going to do anything right now. At the very least, know what that plan is the second you do become symptomatic, because you don't want to be stuck, right? I mean, the consequences of chronic oral infection that becomes acute and flared can be life-threatening. So it's not something to play around with.
Yeah, I think that's a great piece of advice. And, even, at the very least, having, a plan, that's just a great kind of, backup, mentally to, if you're still deciding things, because people sometimes are a little bit kind of here and there, but, I think the information you provide to them, it really helps kind of push the decision along, right?
Right. Yeah.
Kelly, you describe, at your practice, you surgically remove a lot of these chronic infections. Can you tell us a little bit about that? What you see on the ends of some of these, what's sitting there in some of these, and how you detect them, and what you're actually looking at in terms of the what you're analyzing in the specimens after.
Yeah, absolutely. Well, this is a great opportunity for me to share a little bit about how did I, get into this aspect of clinical dental care in the first place. Part of my residency right out of dental school 20 years ago was we worked with oral surgeons at least one whole day a week. So we took out a lot of teeth up at the VA hospital. And then, for the next 15 years, as I was taking out teeth, I kept seeing darkness in roots, which I just didn't think much about it, okay, well, it's dead. And then finally it must have dawned on me, like, wait a minute now. When I do a root canal, because I did them for 15 years, I know it's not black in there when I finish the root canal. Where's this stuff coming from? And so that led me to start sending them off to DNA Connections. That's the lab that I send them to, and doing some microbiological assessments to see what's in here. I mean, we look at guys like you and I, right? That we love to geek out on sciencey stuff. We look back to like, oh, I know there were these studies that looked at how much bacteria were in the canals of teeth when we finished the root canal therapy, right? So we're testing it at the end of the cleaning process and as much as we can decontaminate it. And of course, you see low levels of bacteria because you just cleaned it. But rarely do we see studies, and I don't know many at all except for Boyd Haley's work, that looked at what happens 10 years later, 5 years later, 20 years later, what have you, right? So I started thinking about the physiology and the anatomy of teeth, how they're integrated to bone. What could I affect in that process of root removal so as to optimize like your soft tissue preparedness for healing, the bone preparedness for healing. And over time, we've developed a protocol whereby we tend to use erbium lasers, ozone, LPRF grafting, because I mean, nothing is going to heal your body better than your own cells. For those who aren't exposed to LPRF, we just do a blood draw and spin out your healing cells and then concentrate those back into the extraction site. We've been doing that about 2.5 years now with the LPRF, which, and I mean, I couldn't go back, right? We're getting the whole team trained up on phlebotomy now, right? Because we do it that frequently. But what we're finding is, and if people look at my at Blodgett Dental Care on Instagram or go onto Facebook, if you read my posts, rarely am I sharing opinion. I'm sharing patient stories, what they share with me. I'm sharing what we saw once those teeth or cavitation lesions, chunks of bone, things like that, once those come out, and the information that we get from the microbiological analysis. And, it's usually a multitude of bacteria. Sometimes, well, actually, a lot of times we see parasites and amoeba species. Sometimes viruses. Saw one just this week, cytomegalovirus, HPV 58, all sorts of weird things. And then it's not only these root canal teeth, but the cavitation areas. When we make incisions and look at bone in areas where we suspect there might be, poor healing in the bone. I can't count the number of times I see blackness inside the jawbone. And again, this wasn't stuff I got trained in dental school. It was stuff that patients came asking about. And so I, just started reading more about that, getting some training with other people who've been doing this long before me. We're starting to integrate more and more energetic assessments, so EAV testing, different versions of muscle testing. And again, as I mentioned, we've connected with a lot of naturopathic providers who will do this stuff for us. I want to send them to people that are really familiar with that right now. And it's great. It's great to have that validation that not only do we suspect, we see problems on the 3D cone beam radiograph, but energetically, the body's also giving us information that's telling us there are problems. So those are the types of assessment we do. We've been using 3D radiography for 12.5 years. I couldn't imagine doing dentistry without it. It's so helpful to see a three-dimensional entity in 3 dimensions. So, those are kind of the pieces of the puzzle, I guess I would say, that we consider.
For those, can you describe a little bit about some of the symptoms you see in people suspecting they have a cavitation? And, you mentioned your wisdom teeth extractions, and just explain a little bit about what you find and the process.
Yeah. So frequently, not every time, of course, but frequently, there's a lot to be learned from listening to the patient history and what did they experience after their extraction. I would say by and large, I hear these stories of, gosh, it was a horrible experience. I had a dry socket, and they don't know what that means. They just know it hurt like heck. And then after a month, it healed, I guess, right? And we combine that with what we then see on the cone beam scan, which is typically an area of darkness, some bigger than others, but very frequently you can actually see the outline of the old tooth because it never turned into new healthy bone. Symptomatically, I've seen things from trigeminal neuralgia, which is, just a blanket term for you have inflammation in, the nerve that goes into your jaw. Well, of course, there's chronic infection in there. You should expect that. Sometimes we'll see issues along those energy meridians. So in particular, the wisdom teeth connected to the heart meridian. People with unexplained hypertension, let's say. We certainly want to consider, is there a connection with their wisdom tooth areas, right? And sometimes they're silent. Sometimes, we see things on scans that don't look right. And it's either they're literally asymptomatic or they've become so accustomed to feeling like garbage that they're just not aware that, oh yeah, this could be part of it. So, in practices like ours, right? I mean, the digging is deep. We try to ask a lot of questions and really understand that history. Like, for a lot of people, like, they don't have a memory of what it was like after their wisdom teeth extractions because they healed well. They're like, great, your scan looks good. The story's, inconsistent with problems, super duper. I think you're going to be okay. But if they say, yeah, I had dry sockets, we're going to start digging deeper. And frequently these days, we do go for either muscle testing or EAV to validate that.
It really is an area that, we obviously, so many people are having their wisdom teeth extracted now. And yeah, like the vague symptoms, but you kind of, you touched into, something that I'm finding that is, very, very important is the individuality of it all, and how people experience this differently. It really does come with kind of a bag of common presentations. You mentioned Hashimoto's disease. Chronic gut issue, autoimmune conditions today are so common. And we're talking about there's many autoimmune conditions that people are suffering from today, and these are we're talking about the body's own self-healing process. And you're describing this right in the mouth of what you're looking at. And when we're not getting the baseline right, we're going to see these symptoms, and it is all connected. In terms of I wanted to dig into a little bit about your pre-patient kind of process, because I think that's so important. People kind of realize that I think some people come into this thinking, I'm going to get this tooth out, or I'm going to get this tooth, and then I'm all going to be better. But it really isn't about that, is it? It's about having this whole approach, to making yourself better. So, what are the things that you start to look at and to build out, this profiling for people, and to help, to start pushing them onto a road to health?
Right. Oh gosh, great question. A big part of it now, we're constantly evolving, right, as we learn more. A big part of it these days is making sure, one, that the patient is committed to a pathway of health and recovery, because it's something that took 20 years to develop. You're not going to get better in a week. Making sure they have a great health team around them. And that's, gosh, it's one of the ways things I love about social media is that our ability to connect with people, across the world now is so much improved. And also understand what's their history and where are we today in their progression. So somebody who said, gosh, I only eat green, I'm juicing every day, I'm doing all this. And we're like, gosh, that's fantastic. I'm so glad to hear that. So, how long have you been approaching your nutrition that way? Well, my wife got me on this 3 weeks ago. I'm loving it. We're like, okay. So, prior to that, I was eating Burger King every day or whatever, So understanding all those pieces to the puzzle, like where are we in the progression? Who's on our team? I'd love to understand with those other, particularly naturopaths, because they seem to be highly aware of the importance of the terrain. Like, once we shake all this stuff up, right, the body's been busy keeping the best balance that it can with whatever stuff we put in people's mouths over time. As we start to take that apart or disrupt it, the body has to then process that, right? And gosh, a lot of the people that we see they're pretty unhealthy. So that question of, are they ready for this? What type of systemic support, process, what have you, should we consider so that you can heal best? And if I'm being totally honest, that's just something we're continuously developing in our practice. It's a lot of fun though, because as we do it, we start to see people actually getting better. But it takes patience, right? Creating those expectations with folks that, okay, this took 30 years to get here. Your gum disease didn't show up yesterday. To help you get back to predictable health, it's going to take time, commitment, consistency. Yeah.
Yeah, absolutely. And, it's always that conversation, isn't it? Where, you try and open up that, this is a path and we're all learning here, right? And that, if we're all going to walk the path, but like you have to kind of be committed to, there's not going to be an end solution, straight away. There's always work to be done. Dr. Blodgett, I'm going to bring up we've just had some questions come through on cavitations because I think there's a bit of confusion out there. As Andy asked, how do you know if you have a cavitation?
Yeah, great question, Andy. So, as we mentioned, the 3D cone beam scan is a great way to start. That technology, by the way, has improved so much over the past 13 to 15 years that it's been around. So looking at those cone beam scans is the best start. But asking yourself, what was my experience like? Seeing if you can recall, do I remember there being problems? And then, some muscle testing we've found to be very effective, particularly when you have a practitioner, who's really comfortable doing that, or doing some EAV work. There's also a newer technology. I'm fascinated by it. I haven't happened to get my hands on it, but the Cavitation, which is kind of using ultrasound technology to visualize the quality of the bone as you use the scanner. I'm fascinated by that.
Yeah.
Yeah. I know that it came out originally 10 to 15 years ago. I'd heard of it. It went away for a bit. They've just launched the Cavitation 2 or what have you. So, it's on my list of things to look deeper into. So those kinds of technologies where you can understand something about the quality of the bone would be worth looking into. But I would definitely start with the cone beam. Like if you're seeing a dentist who's not currently using a cone beam or a 3-dimensional radiograph, start there. That'd be a good start.
Julie asks, what is the fail rate for cavitation surgery in your opinion? I had cavitation surgery and still have pain in the areas and symptoms are worse. Have you had any?
That's a great question. So it gets right to what we were just talking about. To what extent does the infection in the bone go? Can you see the infection visually? And this question actually came up when I was doing a webinar a few months ago, which is what led me to invest in my own EAV system and get committed to learning it. The question came up, how do you know when you've removed enough, right? I've certainly dealt with that where I open up areas of cavitations. You see all this nastiness, black material, globules of stuff coming out, but the bone peripheral to that obvious area might also be significantly infected. So, based on what I currently understand, and maybe this will improve and change with time, having some energetic testing to validate when you've gotten to the end, like let's say you think you've got enough, you use your EAV or you do some muscle testing to see, nope, it's still not testing, it's not balanced. Maybe you keep having to remove. So,
Dr. Blodgett, another option. Clarify what EAV is for the.
Oh, absolutely. I'm sorry. Electroacupuncture according to Vol, and there are, it's also known by acupuncture meridian assessment. There's different names it goes by, but essentially you're using a very low voltage electrical circuit where the patient and their energy meridians become the resistor in the circuit. And all these different acupuncture points on fingers and toes help us measure different energy meridians within the body and organ systems. There's a way to also include teeth in that measuring practice. So it's a great technique, not tremendously common, but really helps for issues like that, because how do you know when you've removed enough?
It's obviously quite rare for dental practitioners to have this kind of, but a lot of people out there are finding practitioners using this kind of and bringing it all together, which is kind of where we're going with it, right? Like that, when we find great practitioners that do good work, it only assists our work as well.
Absolutely.
Kelly, for a long time, people have had metal restorations and certain types of restorative materials, and there's a push around the world now to decrease the amount of, for instance, amalgam restorations being placed, but there are still a lot of people with metal fillings in their mouth now.
Right.
What's your approach? What's your experience in this, and how do you approach metal in dentistry?
Yeah, great question. I would agree that if we could have a mouth that had no additional electrical ions or metal ions being released, that would be ideal. I mean, ideally, people don't develop symptoms of decay in the first place. But you're absolutely right. I mean, even the American Dental Association has finally acknowledged, yep, in fact, when you have mercury fillings placed in your teeth, they constantly release mercury vapor. Some people process that better than others. You add to that metal-based crowns, the metals that go along with orthodontic treatment and retention. We see a lot of people with fixed metal bars to hold their teeth in place. And all these things start to add up. And then, metal implants as well. And it's not to say that, titanium implant, bad. There's a lot of people who tolerate them well. There's a lot of people who tolerate titanium shoulders and knees pretty well too, right? But every time we add more metal to that battery, so to speak, the risk for affecting our bioenergy increases. And as we were talking about earlier, I mean, bioindividuality is huge. Some people tolerate anything. Some people can't stand the Wi-Fi router, and so we have to be aware of that. I was actually just talking with a gal yesterday. She's been treated for years for leaky gut issues, right? And we look at her mouth and she has 3 different metal alloys in her mouth. And I ask her, are you able to wear nickel containing earrings? And she's sort of, oh my gosh, no, I can't wear any of that. I used to have a belt buckle. My belly would break out and I'm like, yeah, I don't think metals are really good for you, especially nickel containing. So, but for somebody else, maybe that's not an issue. And I do know there's some MELISA testing now that you can do with blood samples. Similarly, you could do muscle testing around that as well to see if somebody is not energetically doing well with metals. But I think, if we can stick with non-conductive materials, that's probably going to be better than putting metals in mouth, right?
Yeah, there's definitely a move away. So what do you suggest for people? There's obviously a lot of metal restorations out there now. We've got, amalgam fillings, but as you said, metal-based crowns. How do you suggest if people are, suspecting that their health is affected, to approach, potentially removal or even just the potential side effects of removing and so forth?
Right. Yeah. So I don't know, it was maybe 3 or 4 years ago that we kind of got on the bandwagon. We've always been rubber dam users, in our practice, just because you don't have to fight with tongues and cheeks and all that. But getting through the SMART program that the IAOMT, which is a kind of a holistic dental organization that supports healthy dental choices, they came up with their SMART protocol. And so we now use vacuum systems to help as we're taking away metals. We do not want to increase the patient's exposure to them. And frankly, I don't want to expose myself or my team members either, because we're the ones that are exposed every day to this stuff, right? Mm. So being very thoughtful in terms of how can you remove that stuff, because sometimes people, you can't get a rubber dam around a root canal that they've shoved mercury 5 millimeters under the bone level. How are you going to get that out safely? So thinking through how do you do this safely so the patient isn't exposed, they're not swallowing it, they're not inhaling it. If we can decrease those routes of exposure, then I think we have a good opportunity for decreasing energetic risk to the patient. When I hear people getting mercury taken out with no precautions, I just think it's crazy, and we see it all the time, right? By big names in dentistry, people out there going, "Hey, we're doing all this awesome ceramic stuff," and they're just grinding out mercury in an exposed mouth. That mucosa absorbs everything. That's just horribly risky. So we don't want to treat the gut that way.
Yeah, and it really does kind of paint a picture as, we live in a society now where we're exposed to these things that our body has to deal with. And, when we increase our exposure and we have opportunities to kind of, control how much is, it's like mercury, for instance, it's a really toxic, element. And, we take it in via seafood. You can.
Right.
They used to have it in paint, but if we can control this, and certain people will tolerate mercury fillings better than others. On that, what have you seen in terms of symptoms with people with metal issues, and have you seen any kind of connections to mold issues with people because there's often a connection. Well,
yeah. Absolutely. So again, I just think of the patients, right? I think of the individual patients that I've met and heard their stories and watched many of their recoveries over time. I would say, to what extent is mold involved? Probably a fair amount. And to be honest, like for a lot of folks, we're not looking that closely. However, when we, take off crowns, for instance, where we see warm, moist environments that are black, probably a good chance there's mold. We're just not testing for it, but it'd be another scientific thing to look into. The mercury stuff is so amazing to me because, like, I remember giving a talk maybe 5 years ago to one of the local county dental societies. They wanted me to come talk about holistic dentistry. I thought I was going to get roasted, And it turned out that one of the dentists there shared his own testimonial about having developed epilepsy after having had like maybe 6 or 8, mercury fillings put in his mouth as a kid. He then goes on to go through high school, college, dental school, all this, taking medication to manage his epilepsy. He then decides, I want to get the mercury out because it doesn't look good when I'm talking to my patients and I've got, darkness in my smile. So he removes those all and, has some composite and some porcelain restorations put in there. And his epilepsy seizures go away. And it's like you could have heard a pin drop in this room, right? And those things happen all the time if we're paying attention, but so frequently we're not, right? We just, I don't know why you develop, autism or epilepsy or who knows what, right? Hashimoto's, it's just, that's just autoimmune or something, right? We just give it these crazy terms, even though we're environmentally exposed to stuff that's horrible for us. And the mouth is such a common route of exposure.
Absolutely. And, you mentioned, the acknowledgement of gases, and the respiratory route, because we think of swallowing
right.
Into the digestive route, but the respiratory route really is, this is where our body's consuming these things, and maybe even a faster route to the brain too. And so the immune system has to deal with all of this. If we're constantly feeding it, right, it's a big consideration. How do you? You mentioned porcelain. So, can you explain to people your kind of approach to non-metal restorations and what you suggest for people around the world when they're looking for restorative materials?
Yeah, no, that's great. Thank you. As much as we can in our practice, we use CAD/CAM technology, right? The CEREC system is what we use. There are some other versions. Whenever we can put something back into a tooth that is non-conductive and won't shrink, right? There are dental composites that you can put directly into teeth that are awesome. However, all resins shrink when you cure them. So the bigger the hole, the more shrinkage stress you're going to create, and then therefore the more leakage, generally speaking. So, we pick between those things. As the quality of resins have improved over years, we change which one we're using. But primarily, those are our main restorative options in our practice. I love CAD/CAM stuff, right? I love to be able to control outside of a patient's mouth the exact shape and contour of a restoration, and then just put that puzzle piece in the tooth and glue it in there. I will also say a big part of our restorative protocols here is that before we bond anything into a tooth, whether it's glass ionomer, resins, what have you, we will expose the dentin to ozone gas, which I have found since starting to use ozone has been it's just so helpful in terms of minimizing, if not totally negating, post-operative sensitivity. For years prior to that, we were using Gluma, which is a glutaraldehyde-based material, which also works great. But if I can use oxygen instead of a chemical, I'll do that. So anyways, the process, as it is for most conscientious dentists, is very meticulous, which is why people generally have teeth that feel good once their teeth are restored. But those are great options.
Yeah, because traditionally with ceramic and porcelain, you can get some sensitivity. So it's a great point for people to kind of be mindful of. Kelly, we're coming to the end. You're such a wealth of information. We could talk for hours on this stuff.
Yeah.
Would you like to? You've got so many great patient stories that I think really kind of help. People kind of picture and envision, how powerful the mouth can really be. Have you got anything, recent or one of your memorable patient stories you'd like to share in terms of how their health turned around?
Yeah, absolutely. And I posted this. I'm thinking of one fellow. It resonates with me so much because he had come to see me 3.5 years ago, right? And at that point in time, he had 4 teeth, all on the right side, is all of his molars, that had fairly good sized mercury fillings, right? And of course, as it is common, fractures occur in the teeth. We can see the black lines. And so I talked to him about, it would be a healthy option to remove that safely, put in some ceramic restorations. The holes won't get that much bigger, and we're going to preserve all the periphery of your tooth. So he unfortunately decided to, go to a different dentist that was, like in network with his insurance program, who that dentist then decided to strip off all the enamel of his teeth and make crowns, right? Full porcelain fused to metal crowns. Well, understandably, when you strip all the enamel off the teeth were highly sensitive. The dentist said, "Oh, well, you need a root canal. Like, it's no big deal, right? Let's just kill some teeth." The guy ends up having 3 root canals within the last 2 years, all on molars on his right side. All of the molars are connected to the stomach and gastrointestinal system. The guy starts experiencing, within a few months after having the root canals, like horrible GI issues. He's experiencing bloating, all this crazy stuff. So he calls us. This is right as COVID is starting, and the guy is miserable, right? The teeth are not feeling great. They never felt great after he had the root canals. But more importantly, his whole body feels horrible. So, we're like, we got to help this guy. We can't wait until, whenever the governor says we can come back, there's an emergency. So we go through the process. Sure enough, we remove these 3 root canal teeth, clean it out, use ozone, put the LPRF in there. When we see him back 2 weeks later, his GI function is totally normalized. And this guy looks like a new human being, like all of his swelling. He said he lost in that 2 weeks almost 10 pounds. And we do see this stuff on a week-to-week basis here, but his was just so gripping, probably because I'd also seen him years before, or 3 years prior, and just, people don't know what they're saying yes to, right? And I think if your provider is saying, you need this, they don't give you any other option, you need a crown, it is worth, your health is worth asking more questions than that. And I encourage people to do so. Don't always take a doctor's word for it. Get a second opinion. Now this guy's missing 3 teeth, right? We could have prevented all this stuff. So his is a particularly powerful story when I think about that. And there's, hundreds of others I could share, but yeah, as you say, we only have so much time. Maybe we can do it again sometime.
Absolutely. Yeah. Just quickly before you go, what's your approach to missing teeth? Are you you an implant guy, or what's your approach there?
Well, yeah, that's one of the options. I really try to get with patients and understand what are their goals, and it's like, what's their goal? What's their budget? How do they feel about teeth that come in and out of their mouth? I will say, I've been placing implants for about 17 years. For a lot of people, they can be a wonderful way to replace teeth, right? We're starting to do more and more in the realm of zirconia implants, but we still offer titanium for some people. There's just no one thing that fits the bill, right? But we do a fair amount of like Duraflex acetyl resin partials too. Just kind of depends on what the person wants.
Yeah, there's so much. It's difficult, isn't it? But there's options out there, and it really does depend
Absolutely.
on where they're in their life and budget as well, because some of these options are quite expensive. Yeah. Kelly, you're such a learned guy. Share with us where you'd like to see the world, in terms of oral health, and where hopefully this kind of conversation can be in 5 years. Like, where do you think this can potentially take us?
Oh my gosh, awesome question. Yeah, I would. Well, first of all, in 5 years, I hope to have met you personally. I know we'll have a good time. I would sure love to see so much more emphasis in dental school focused on nutrition. We got to start from the start. I know you've had Dr. Stacy Whitman on before, who's a good friend of mine here in Portland, Oregon. She said to say hello, by the way.
Stacy's amazing.
She's awesome. I mean, but you got to start in the gut. And she, as a pediatric dentist, I mean, the poor woman sees so much dental disease that's totally unnecessary. The processed food industry has just killed GI health and oral health, and we need to get back to our roots. I mean, I seriously have told more people about the dental diet, and I'm not saying this just because we're talking. Like, if you want to understand how to be healthy, start with your gut. Start with what you're putting in your body. You give it the right things, and your body knows what to do. Give it the right building blocks. So hopefully more of dental education is focused on the wellness of the individual, not about where are the holes that I can drill and fill. And that's probably going to take more than 5 years. But that's where I hope it goes.
Well, moving in the right way, and as you say, there's a huge, movement now of people to understand the bodies better. And, we've learned so much, you've described your practitioner journey, which is so valuable for people to hear. And, it's not a linear journey for anyone, right. Straight after you come out of dental school. And this is all changing. And, the things you're talking about, is very rare. Your center in Portland, is a very rare thing for people to come across. It's different. You do things differently to what I do in my practice. And so, maybe these things are going to, hopefully come together a little bit, that we can, build a model that completely brings all the different dots of the puzzle together. Right.
Right. Absolutely.
Kelly, it's an absolute pleasure. Where can people find you if they want to find out more about you online and also your practice?
Absolutely. So our website is blodgettdentalcare.com, and we are at Blodgett Dental Care on Instagram. Same thing, or Blodgett Dental Care on Facebook. I mean, we try to continue to share stories and truth and light, and be a place where, like, we are willing to hear a person's truth and reality and experiences in a, like, with no judgment, right? I mean, there's so much of the psychological aspect and emotional aspect that keeps people away from seeing guys like you and I. And it's like, your life sometimes, is in the balance here. Having a thoughtful oral healthcare and oral medicine specialist on your team is so critical. I would love it if more and more people would please, as you go on to Instagram and such, share this with your friends, right? Share Dr. Lynn's name, share my name, get the word out so that we can change the world of healthcare.
Dr. Blodgett, thank you so much for the work you've done, the passion that you put into your patients. You really help a lot of people out there, and for getting this message out there. We'll definitely have to have this conversation again soon. Stay well there in Portland. We'll talk soon.
Thank you, sir. Absolutely. Thank you, Dr. Lynn.